Welcome to the Senior Moment. This is Connie Clark with Home Helpers. And this afternoon in the studio with me, I am very, very honored and very, very pleased to have Dr. Susan Melchiore with me. She is with the Memory Clinic here in Coeur d'Alene, and she is what's been known as the Alzheimer's Whisperer. She is she is our local expert on dementia, and this is a subject that is very near and dear to me because, as a lot of you know, my father had Alzheimer's. And so when I'm dealing with families who have someone like that, I can totally relate to the different experiences and situations they're running into because I was there. So Dr. Melchiore, welcome. Thank you so much for coming on the show with us today.
Thank you for having me.
So the first question I want you to explain to everyone is I hear a lot of people confuse Alzheimer's and dementia and that they're not the same thing. And could you please give everyone a definition of what those two things are so that they understand the difference between the two?
Sure, and that's a really common misconception because the best way to think of it is that dementia is sort of the catch-all term. Dementia is the umbrella term for a problem in the brain that causes thinking difficulty. So it's a very general term of dementia. And then there's different types of dementia. So I sort of think of it as you could say there's trucks, but then there's Chevys and Toyotas and Dodge and pick your favorite. So there's all different kinds of trucks. Well, similarly, dementia is the catch-all term, and then there's different types. So Alzheimer's disease is one type of dementia. And then there are other types, such as vascular dementia, stroke-related dementia, dementias associated with other illnesses, such as Parkinson's dementia. There's one called Lewy body dementia that seems to be surfacing. We're recognizing it more lately, and several other types that are less common. But generally, dementia is the general term for some brain disorder that causes thinking problems.
How would you know what the difference is?
We can tell the difference most of the time by doing a very thorough history from the person, their loved ones, their family, as well as some very basic physical exam and sometimes blood work exams. Occasionally, a head scan, CAT scan, MRI might be needed, but generally looking at the whole story of the person is critical to trying to tease apart what the risk factors are and what's causing it. Knowing what's causing it then helps us know how best to treat it.
And aren't there some certain medical conditions that can cause dementia-like symptoms?
Yes, there are a lot of dementia mimickers, as I might call them, or things that might appear as dementia but really aren't. They're treatable, reversible, and we look for those because we can treat them. Oftentimes, someone may present with confusion, and it's due to an infection. Pneumonia or a bladder infection can present as confusion, losing things around the house, trouble with language, word-finding difficulty, and we might think there's dementia, but it's actually an infection or an endocrine problem like a thyroid abnormality. Sometimes folks that have sleep disorders like sleep apnea have cognitive or brain function changes the following day. So there are medical conditions that are treatable that look like dementia when they're flaring up or not controlled. So it's really important to get an early medical evaluation to see if there's one of those reversible things going on.
Would those be things where all of a sudden the person becomes confused?
Sometimes. Sometimes there's a slow ramping up and then suddenly falling off the cliff. The challenge is that we can't always separate things. So it might be a combination of causes. So someone may have early dementia, very early, but they develop a bladder infection or they develop a pneumonia or they get started on a medicine over the counter that tips them over the edge and suddenly they're much more disoriented or much more confused. So it's often a combination of factors that results in what we see.
So it's probably really a good idea if you've got a loved one that is showing confusion to go in and find out if it's really something that is neurological or if there is some sort of infection in their body that's causing it.
Absolutely. That's very important.
Because if they don't treat the infection, then that can cause something
Worsening.
even worse.
Sure, right. So you want to get evaluated to see if there is something partly reversible or fine tuning of diabetes or sleep apnea or oxygen problems that can be improved. And then that will improve the person's ability to think clearly.
Now, explain. I know Alzheimer's is the predominant type of dementia. Explain what Alzheimer's actually does to the brain.
Yeah, that's a really good question, and we're still learning that. But there are clear findings on doing a brain biopsy, let's say, which we hardly ever do anymore. But you can actually see under the microscope changes in the brain. There's things called amyloid plaque, which is a buildup of a type of a protein that gets into a clump in the brain. And you can actually see those forming under the microscope. There's also things called tangles or neurofibrillary tangles, which is just a fancy word for a bunch of nerves that get tied together into a non-functioning network. And so there are actual physical changes in the brain with Alzheimer's disease. And that's important to remember because it is not just a problem with the person's thinking. This is different from mental illness. This is also a structural problem that we can see in the brain, and there's physical changes taking place. Often these plaques and tangles lead to shrinkage of the brain in certain areas. So nowadays we're doing scans such as special CAT scans or special MRIs to look for the volume or the size of certain parts of the brain that tend to shrink early on with Alzheimer's in order to try to diagnose earlier.
And I know I've had a lot of people try to get me to tell them specifically what kind of behavior changes to see. And my response is always back to them, well, it's different in every person because the disease travels through the brain differently in every person. So the way they react to it is going to be totally different.
That's true. What we see in the day-to-day functioning is different. However, there are some common threads and common things to look for. So early warning signs of dementia might be trouble remembering events or trouble remembering important conversations, losing things very frequently around the house.
Not just occasionally like some of us do.
Right, not just occasionally. You know, the problem where you walk into the room and you're not sure why you walked in there, that's actually pretty normal as we get older.
Good.
That's what a true senior moment can be. It usually comes back to you later, comes back to the person to remember what they wanted to say or what they were going in the room for. It's the case where we never remember it, and we never remember that we couldn't remember it. That is troublesome.
Okay.
Losing things around the house then can be common, or getting lost in a familiar setting. Having trouble doing things that we used to be able to do readily, such as putting a recipe together and we leave out an important ingredient, or trouble balancing a checkbook where we used to be able to do that. Trouble following a sewing pattern where we used to be able to do that. Trouble playing bridge where we were an avid bridge player. So things where it's something we used to do and we no longer are able to do it easily. Why is that? Something's going on with the brain. So
that's one of the first indicators there's something.
Might be, right. So those are some of the common threads. But exactly what it is that we can't do is going to be individual.
Right. If you suspect somebody might have Alzheimer's, what do you do?
Good question, and a tough one, too, because obviously having memory problems can be a very personal and self-defense issue, tends to come up. So it's important to approach the person objectively with what you see. So if someone is losing things, rather than accusing them of memory loss, it would be, gosh, I see that you seem to be misplacing items frequently, and maybe name what they were that and say, could this be an early medical problem? Have you seen your doctor lately? And getting someone in to see their primary care physician or nurse practitioner, or seeing their, if they have a geriatrician, someone who specializes in health of the aging, or a neurologist. Those are typically folks that are going to be able to get you started on the path to working up what might be causing a memory problem.
Have you seen an increase in the number of physicians that are able to recognize this as a condition? Because I know in the past, some of our general physicians, that wasn't something they normally, had experience in.
Sure. I see a lot of physicians treating memory problems now in the community, and that's great, because the sooner we can start treatment, we believe, is the better outcome. And most primary care providers nowadays will initiate the evaluation and treatment, or referring you on to a specialist like a neurologist or geriatrician that can then do the actual treating. So yes, I think our awareness in the whole healthcare community is heightened.
Yeah, especially since all of us baby boomers are now
Right.
coming into that stage,
That's right.
If you get a diagnosis, if it's you, if you're the person that all of a sudden now has been diagnosed with Alzheimer's, what do you do?
Really good question. One of the biggest advantages in knowing what's going on is to be able to plan, I think, and be able to plan for your life, for your health care, for how you want to be treated, and to be able to make those wishes known so that you can do some advanced planning with your family or your loved ones, so that they know what you want. They know who you want to have involved with your health care, and what you would like done. If the disease progresses, and if you're diagnosed with an early stage, there's often years of time to be able to plan. Most folks live an average of 10 years with Alzheimer's disease, so that's a fairly long time, but some folks aren't diagnosed until late in the illness. So the earlier you're diagnosed, often the better, to be able to plan and also to be able to get on treatment. So if you are diagnosed, not just with early planning, but also looking at treatment options to slow down the progression.
That's what I was going to ask. What kind of treatment is out there?
So there's medication treatment nowadays in the form of tablets or pills that can be taken to slow down the memory loss process. There are 4 different medications commonly used. 3 are very similar to one another, and the other is a separate class of medicine altogether. They can be used together to try to, again, preserve memory function for as long as possible. But another big portion of the treatment involves non-medicine treatment. So lifestyle changes, things where you are actively participating in memory stimulating activities every day. That's something that's taken on a catchphrase of brain fitness. So the more active your brain is, the better it will function. And that works whether we're talking about prevention of dementia or treatment. We've done studies looking at folks taking medication for memory loss, as well as a group that didn't take medicine, but they just did brain fitness exercises for many hours a day, 3 hours a day, 4 hours a day. But comparing their function after several months, both groups did just as well. So the effect of brain fitness exercises can't be downplayed. That's
And when
really
you're
important.
saying brain fitness exercises, we're not lifting weights or anything like that.
No,
What are you
no.
talking about?
Although physical fitness is also important, so I will add that as well as mental exercise. Also, physical exercise, walking, can actually be very good for your overall health, but also your brain health. So, brain fitness is something where you're keeping your brain active. It could be doing a puzzle, it could be woodworking, sewing, a craft, painting, reading a story and telling it back to somebody, watching the news and talking about the news with somebody, playing board games or card games. Could be Bible study, memorizing verses. It could be anything that keeps your brain engaged and thinking and manipulating material is a brain fitness
Not just
activity.
reading, but actually having to think about what you read
Exactly.
and repeating it.
Exactly. It's reading can be very passive if we don't try to recall what we just read. So reading a book or a chapter or an article and then talking about that with somebody, just simply going over who, what, where, when, why of an article is a brain exercise for 10 or 15 minutes a day.
So I'm going to ask you to give me your personal opinion then. You're talking about that keeping our brain active actually slows it down a little bit. What do you personally think about what's going on when we see kids staring at the TV, not, making their brains work?
Right.
What is that saying about our future?
TV is very passive, and it's really kind of probably dangerous to your health. It's almost like eating fried food and smoking and alcohol, and probably not so good for your lungs and your liver, just like TV is not so good for your brain, really. It doesn't keep your brain thinking and working and manipulating information very much. So what that means in 20 or 30 years, who knows? But it's very important to do things that engage your brain. And your
I find
mind.
that interesting that exercising your brain, you got the same results as taking the medications.
Fascinating.
That's
Mhm.
very fascinating.
Yeah, and physical fitness too. If folks are into computers, there are a lot of computer programs out there now, even on the internet. Some are free to download that are brain fitness games and activities to do. So that is another easy way to access some.
Very good. Well, we need to take a break, but I want to continue talking about this. This is something that I know all of us are interested in because it's one of those diseases we can't prevent. So we're going to take a break and we'll be right back. And I apologize for sweating. I had a cup of coffee.
Oh, you're doing great.
I had a cup of coffee and I thought it was decaf.
Oh,
And I react
wow.
to
Oh, my
caffeine.
goodness. Wow.
Apparently it wasn't.
Oh, my
And
goodness.
so I'm like,
Oh, no.
and I could feel myself
Do you
shaking
have a
inside.
fan in here?
Now I can feel myself inside
no.
shaking. That's happened to me before. And I can tell when I've had it.
Do you need to?
No,
do you
I'm
need-
good.
you've
No,
got
I'm
one.
good. It's
Okay.
just I want to apologize so you don't think I'm
you're
nervous
fine.
or anything. It's
No.
just
Is this going okay?
yes.
Okay.
Oh, it's going great. And it's really hard for me to hold back because
You know things.
yeah. And I'm like, okay. So what I'd like to talk about now is okay, so you found out that you have Alzheimer's. You know you needed to make the legal preparations and all of that. And I want to talk about what kind of behavior now that your family or friends might see.
Okay.
And maybe what causes that kind of behavior. Is that okay?
Sure. Yeah.
Because
Probably a lot of things, but yeah.
yeah, well, I'm
Sure,
thinking
yeah.
about what we hear in our support groups, or the kind
Okay,
of different
yeah.
behaviors that
Okay.
people
Good.
exhibit.
Okay.
Like the no bathing or
Paranoia.
things like that.
Trouble with hygiene things. Sure. Good.
Okay. And we're back. Welcome back to the Senior Moment. Again, this is Connie Clark with Home Helpers, and I have Dr. Susan Melchiore with me with the Memory Clinic. She is our Alzheimer's Whisperer. And that is a title you
Never
will
heard that.
always
Wow.
Oh, we talk about you and we say that all the time. But we've been talking about, we first talked about what dementia is and how it's the catch-all phrase. And Alzheimer's is probably the more dominant medical condition under the dementia category. And we were talking about that there are medications and what to do when you find out you have it. Now that you have Alzheimer's, what kind of behavior is your family going to witness that is a direct result of Alzheimer's? Because I know there are certain things I remember seeing my dad do, and my mother covered this up for many, many years. We didn't really realize. And, 15 years ago, I had no clue what any of this was. And so there were certain behaviors that he exhibited. Had I known what I was looking at, I would have picked up right away. So what kind of behaviors would we see our loved ones doing?
Well, that will be individual to the person, of course. And so early on, I think most commonly it's forgetting some of the day-to-day tasks that we need to do, maybe missing medications, missing appointments or events, or keeping straight the details of a more complicated transaction that needs to take place. So oftentimes families will see people destabilize or become unstable from other medical conditions because of forgetting the regular medicines, let's say high blood pressure or diabetes medicine or medicine for swelling. They might forget, and then that becomes
A medical
worse.
issue from the other
Exactly.
thing. Okay.
So, having help or supporting folks with medications and having a buddy system there can be very helpful. The other thing is misplacing items can become very common, and thinking that somebody stole them or someone broke in and took things, or even that someone may have borrowed it and not returned it. That is very common, and it almost takes on a paranoid flavor where people make up a story around the fact that an item is missing.
Because they can't find it.
Because they can't find it, right. And the lost item becomes a focal point. And very often that's the initiation of the more paranoid, thinking people are stealing things, reporting theft to the police when an item is simply missing. So that can be very common. And often it's easier to, our human nature is to blame someone else. So they took it, they moved it, they borrowed it, as opposed to I lost it.
It couldn't be my fault.
Exactly. That's rarely the default answer. So we see a lot more of the theft ring. As the disease progresses, I think basic hygiene issues, keeping hair combed, clothes clean, keeping the house clean or tidy, keeping the refrigerator cycled through so that old foods aren't left in there. A lot of this is simply forgetting to do it or forgetting how to run the laundry machine or the dishwasher. Having trouble with bathing, not wanting to take showers. And these things often come on later in the course of the illness. I don't know that anyone can claim to know why that happens other than a breakdown in our understanding of how to do those basic things. So how to run the shower, how to work the laundry machine, that type of thing. It becomes less of a comfortable thing for the person with dementia, and it can actually be a frightening experience. Imagine entering a bathroom where there's now this funny echo sound in this room. This room seems a little colder. I have to get undressed. Wow, that's kind of frightening. And get underwater that may or may not be warm enough, or maybe too warm. And I don't know how to fix the temperature of the water because I don't remember how to turn the dial the right way. So imagining that whole scenario can be very scary, let alone dangerous in some situations without someone there to help.
And I've heard that a lot in a lot of different folks that I have talked to, that bathing becomes an issue. And it's really interesting when I talk to a new family and they're concerned about their loved one doesn't shower anymore, and how can we get them to do that? It never really occurred to me very strongly that it might be a fear of what exactly you're talking about.
Mm-hmm.
I always thought it was, well, they just forgot how, or they forgot that they hadn't taken one in a week
Mm-hmm.
or whatever. But the actual fear of the sounds and the sight and the inability to know how to control
Right.
the temperature,
Mm-hmm.
that would be scary if
Right.
you couldn't remember how to do any of that.
Right. And so the default action there is to avoid it, right?
Right.
That's uncomfortable. I don't even want to go there. And that happens similarly then with our social interactions. So oftentimes folks with cognitive problems will start to withdraw from social interactions. They no longer want to go to a weekly meeting or visit friends. They won't initiate going out. That's a huge behavior change. The lack of motivation or the lack of initiation of something. If someone comes and brings them, they'll come. But for them to initiate going out to an activity or starting an activity at home often will never happen. And that's part of the illness. Possibly not remembering how to initiate an action, but also just the fear of failing in that social situation, not remembering the people or not knowing what to say or not understanding the conversation around them can be overwhelming. So the default is to draw in, stay home, not do anything. And that's common.
I've talked to a lot of folks that have talked about personality changes. I've heard some people say that, my mother was this meek, quiet little person, and when the dementia really started kicking in, her personality totally changed to the total opposite. And then I've heard people who said, my mother was this terrible, screaming, awful person, and when the dementia kicked in, all of a sudden it was a very quiet, calm, peaceful, loving person. Is that something the disease does? I mean, the personality changes?
Yes, personality changes can definitely come along with the dementia. Sometimes earlier on, even in the illness, and it's very unpredictable. It's very hard to predict how someone will whether they'll get more like themselves and less inhibited, but more like themselves, or whether they'll actually change. I don't know that we have a way to predict how folks will change, but very commonly there's some personality shifting.
When someone has the dementia, I know there's a line they cross over, which I guess is a reality line, that they're no longer recognizing what's going on, who the people are around them. Is there any way to tell when that's going to happen?
It's really hard to predict when that might happen, but almost always, if someone survives to a late point of dementia, they will forget how to do very basic things and forget very close people. Usually we'll forget people that we're not as familiar with, and it's the people that we see every day, day in, day out, that we remember. We may not remember their names towards the end, but we know we recognize them. So you might notice recognition on the face when the loved one walks in, spouse walks in, daughter, son, that they know they've seen every day. But they may not be able to verbalize a name very late in the illness. And at some point, even recognizing the person is often lost. But that's usually very late in the illness.
And I know one of the things, the part of the brain that gets affected in the beginning is a short-term
memory.
So I've heard families talk about that the person lives in the past. They've now associated this is their childhood home, or I'm not home, because they think their home is where they were when they were growing up. That is something that happens quite often too, correct?
Yes, that's a good point, that people do tend to lose short-term memory first. And so remembering the past is easier. And so that becomes the present.
That becomes their reality.
Becomes their reality today, right. And oftentimes it can affect what they think, where they think they're supposed to be today. They may not even recognize themselves. They may look in the mirror and see their mother, because they don't look like how they remember themselves being at age 30 or 40. Instead, that must be my mother because it doesn't look like me.
Yeah, I remember my dad, my mom had gone through some of their old pictures,
Mm-hmm.
and he pulled out a picture of my mom when they were dating. And he carried that around in his pocket. That was his baby. And
Uh-huh.
he called my mom, Mom.
Uh-huh.
And I thought, well, that's kind of weird. You know, of course, I didn't know any of this back then,
Mm-hmm.
but he was living back in the 50s.
Very possibly, yeah. At least temporarily, and what he recognized from pictures was old.
Now, I've heard families talk about that they would sit with their loved one with dementia and go through the old pictures and point out different ones. Is that a good idea to do that with someone?
That's a great idea, and that's a part of something we call reminiscence therapy, which is going over old stories or old times, and often the old pictures can draw out those stories, and that's a great memory exercise. Actually, it is exercising a part of the brain for that person, and it can be very fun. It can be enjoyable. You can often do it over and over again sometimes. And old picture albums can just be a source of all kinds of great stories and good memories and things to talk about.
And they find that it's a way of calming the
Mm-hmm.
person down. And when I say calming the person down, I'm going to go into another subject because we've often heard of people getting, I guess they're frustrated when they can't remember how to do things. And my mom used to argue with my dad. You know, if it was green and she knew it was green and he said it was purple, she would argue all day long that it was green,
Mm-hmm.
you know. And I could see that wasn't working with
Right.
him.
Right.
So, how should you react when your loved ones start these behaviors and start forgetting things that you know they should have remembered?
Mm-hmm.
You know,
Well, the first rule is never argue with someone who has dementia, I think, because you'll never win that argument. It's best just to let that go as long as it's not a safety issue or an issue of personal harm about to happen. So really not to argue, go along with the story as long as it's a safe story and it seems to be calming the person. That is generally a much better approach. So, in almost every situation, whether it's a behavior or verbal thing or frustration.
because yeah, she would sit and argue with him, and I knew she wasn't going to win, you know, but she just was bound and determined that that was going to be green, whether he wanted it purple or not.
Right, right. And it's probably not going to hurt the person to think that it's purple, and it's okay. Later on, they might get their language words straight and make it green, but it's okay to call it purple for now. The other thing is not to try to attack the person or try to correct them. Some people don't see correction as arguing, but to the person with dementia it is, and it can put them on the defensive. So even if the dementia person believes that they did something in the past, well, I took care of that, I'm sure I did that, but you can obviously see that the task is undone, it would be fine to just say, okay, well, that's fine, and move on, rather than try to prove them wrong by forcing them to look at the task that's undone. Is that making sense?
That makes total
So,
sense.
Rather than push it into their face, it's much better to just let it go, because they're going to simply get on the defensive and they won't have a way to defend themselves. And you're pretty much rubbing their face in it, and that's not very helpful. If it doesn't lead to an angry outburst, it might just lead to making them feel depressed, worthless, and unable to cope with all that's going on. Depression is very common.
I was just going to ask you about that.
So it is very common in folks with dementia, especially the early and middle stages, when we're still able to recognize the loss of our ability to do certain things. It's a huge adjustment, and many people go through periods of depression. Some of that can be helped with counseling, support, medications, that type of thing. But again, trying to encourage the person to do as much as they can is important rather than discourage them by pointing out their faults. So,
Well, we're going to take another break, but I want to keep talking about this because the rates of Alzheimer's is increasing. And so I want to talk about what's going on, I guess, to help some of us who haven't quite gotten it yet. So we're going to take a break and we will be right back.
you're so good at this. So how did you learn how to do radio interviews? I feel like I'm looking through this at you too. I think I'm
Um,
trying a little bit.
Not too long after I opened my business, I was
Oh.
doing marketing,
Oh.
trying to market. And
Mm.
one of the salespeople from KV&I, she was getting me to do commercials. She
Oh,
says,
wow.
"Why don't you come on once a week and talk about senior stuff?" I'm like, "Yeah, okay."
Oops.
And
Yeah.
the first time I walked into the studio over
How
there,
fun.
I was just, okay, now what do I do?
Yeah. Yeah. How fun.
And I will say that the DJs there were really great in making me feel very comfortable.
Good.
And when I would be like, okay, now what do I say? They'd jump in. They could recognize that I was kind of at a loss.
Mm-hmm.
And so after doing that for a while, and I started going in and talking about things I knew,
Mm-hmm.
and then I started running out of stuff. So then I started asking my friends who like would work in a skilled nursing or something like that to come in and talk about what they do,
Right.
and I would
Yeah.
ask them questions,
Mm-hmm.
and then DJs would ask them
Mm-hmm.
questions, and it just kind of went from there,
That's good. Yeah.
you know. And when KV&I changed their format to ESPN and shortened their morning show,
Mm-hmm.
the portion they shortened was the portion I was on.
Oh.
So then they started bouncing me around times and
Mm-hmm.
days, and it
Mm-hmm.
really wasn't working because I started. It was kind of weird, but I started having people actually listen to me on purpose, you know.
Great.
And I would go into someone, I'd be
It's helpful.
bowling, and someone would see my name. You're the one on the radio.
Oh, that's amazing.
Oh,
Wow.
you
Wow.
know,
Yeah.
it was kind of
Right.
cool, you know.
How fun. That's cool.
But when they changed, all of that, I thought, I can't, this isn't working.
Mm-hmm.
And then this opportunity came up, and I thought, I can do this, but it's
Mm-hmm.
an hour.
Mm-hmm.
Um,
Mm-hmm. Well,
and
you're
I
doing
started
great
out
with it.
with bringing my friends in,
Yeah.
that
No, that's always good.
and
That's great.
it just started getting easier.
That's good. Yeah. It's great. Seems like you're naturally directing where we go. That's
Well,
great.
and it's kind of now it's kind of fun,
Mm-hmm. Mm-hmm.
you
That's
know.
good.
Um, and I get to have people on I want to have on. So
Yeah. Oh, that's great. Well, hopefully this is going to be educational and
oh, it
helpful.
will. It
That's good.
definitely will. And what's really been neat is all the interviews that I've been able to have. Um, I have shared with our other offices. We have over 600 offices.
Really?
I'm
Oh,
a
the home
franchise.
helpers.
Yeah,
Oh, okay.
I own
Okay.
this franchise, but
Oh,
there's
okay.
so I'll post them and then send
Yeah.
them all
Yeah.
off all so
Wow.
they get listened to all over the country,
Mm,
which is really
neat.
kind of
How
neat.
fun. Yeah. That's great.
Yeah, this is fun. So, what I want to do now is talk about okay, because I've heard PJ on her soapbox talk about that, a lot of the other diseases, cancer,
Oh. Mm-hmm.
those kinds of things, the mortality rate is going down,
Mm-hmm.
yet the
Mm-hmm. Right.
incidence of Alzheimer's is going up,
Right. Right.
and kind of talk about that
Mm-hmm.
and
Mm-hmm.
maybe some research things.
Mm-hmm.
Um, are you in a position to talk about some of the things, some of the homeopathic things people are throwing out, or no?
Um.
Because if not, I won't even go there.
Right. I'm not a homeopathic person, so I probably have no
Okay.
expertise in that.
Okay.
And what I would say probably wouldn't be very encouraging.
Well, but if
So,
that's the case, then that's the
I mean,
case.
the really, double-blind controlled studies that they've done looking at some things like, estrogen and ginkgo and nonsteroidals and vitamin E have fallen flat. So
someone's
invest your
taking
money
that,
there, but
if someone's taking that thinking
Yeah.
that's going to
yeah, to
keep
help,
them
yeah,
from getting it, then
right, yes, and that hasn't panned out. So they're still working on other things. So yeah, and there's a lot of stuff in the pipeline coming. So that's kind of
um, are you in a position to talk about percentages as to what percentage of us are expected to have it?
sure. And we could talk about the prevalence as people get older and
Okay,
sixth leading cause of death and that
okay.
kind of stuff. So
Because I don't want to throw out something and you look at me like,
yeah,
yeah,
no,
the deer in
that's
the
okay.
headlights thing.
Yeah, hopefully not. No,
Okay. Well, I mean,
no, you
sometimes.
can fill in if I don't know it.
Okay. All right, you ready to start back?
Yeah.
Welcome back to the Senior Moment. Again, this is Connie Clark with Home Helpers, and I have Dr. Susan Melchiore in with me today, and she is our Alzheimer's whisperer. She is our local expert on dementia and everything having to do with, I guess, us getting older. You know, I have heard a lot of people talk about Alzheimer's and comparing it to some of the other medical conditions that we face as we get older, talking about cancer and some of the other things that cause us to die, very bluntly. And they've been saying that all of those heart conditions and that, those cases are going down, yet the incidence of Alzheimer's are increasing.
Right.
Is there anything we can do about that? That seems kind of scary.
Right, right. Well, it's been a question as to why are we seeing more Alzheimer's too. Looking at our whole population, we know that age itself is a risk factor for Alzheimer's disease because as the population gets older, age is associated with more dementia. In fact, almost 50% of people over the age of 85 develop or have some type of dementia. So that's almost half of our population over 85 has dementia of some sort. So it's very, very common. And as the baby boomers come along, as you're saying, we're cresting into Medicare age now, and this tidal wave of people at risk is growing. So we're also diagnosing it probably more often. We're more aware of it now in the healthcare community.
Do you think that, 50, 60, 70 years ago, that there still was this large amount of Alzheimer's? It just was that our population wasn't getting that old, and that we said, well, we sent them off to institutions, or that's grandma, she's just crazy, she's sitting over there in the rocking chair. You think it was actually there all this time?
I think it has been there. I think we haven't been labeling it or diagnosing it. Even nowadays, a lot of folks come up to me and say, "You mean it's not normal to lose memory as you get older?" No, that's not normal aging. Normal aging does not involve memory loss. There's something going on. Doesn't have to be dementia. It might be something else we talked about, like in the beginning. But very often, it wasn't labeled or it wasn't called an illness because people assumed it was normal in their family tree and
They're just senile and ignore her kind of thing.
Exactly. And now there are more aging folks too. Just our population is greater of the aging folks because they're surviving the heart attack, they're surviving the cancer, and now they're living to older ages where the risk of developing a dementia now is greater. So we really do have this tidal wave coming of dementia care that's going to affect everybody, not just the patient, but their families with it.
So our ability to cure all of these diseases that were killing us when we were in our 60s and 70s and prolonging our life is actually making us more susceptible.
In some way, you could see it that way. In some ways,
you
you
know,
could see it that way. Right.
And
Other things.
there's really no way to predict who's going to have it, when they're going to have it, or if they will have it.
Well, there's no way to predict, but we do know risk factors. There are risk factors. So
Okay.
age is one risk factor. We believe if someone has had head trauma in the past, that might be a risk factor. Think of people who were boxing or have had multiple athletic injuries and then they have developed Alzheimer's or cognitive problems as they age. We also think family history in some cases can be a risk factor. Usually, this is for the younger onset Alzheimer's
Now,
under
define younger onset.
under the age of 60. So, if you have a parent who developed Alzheimer's before they were 60, that would lead me to say, let's evaluate our family tree. Is this running in the family? Should we look at more genetic testing? We don't have perfect genetic testing right now. We have some markers that suggest it might be a high risk family for Alzheimer's, but it's not clear cut genetic testing yet. The other risk factor is things like diabetes and heart disease. Anything that's bad for your heart is thought to be bad for your brain. So we're finding an association. I'm not saying a cause and effect, but an association between diabetes and vascular risk factors for dementia. So, in that sense, if you have those things or are at risk for those other diseases, all the more important to be exercising physically and getting mental exercises every day to try to prevent any onslaught of memory problems. The studies do show that people that stay active and stay connected socially are much less likely to develop dementia, or if they do develop it, they will be much older when the symptoms start.
That's really interesting that you said 50% of the folks
Over 85.
over 85, because that population is getting larger.
It's the fastest growing population in our country right now.
And I know a lot of people that are over the age of 85. And so if I were just to look at all of them and go, okay, half of you have some kind of dementia, it would be really hard for me in some cases to figure out which ones had it. You know, some cases would be easy, but in some it would really be hard. And as we all grow older, you know, I myself, I think, well, I've still got 30 plus years going, but some of that's past 85. So,
Well, and
You
there's
know.
two ways to look at 50%. There's 50% that have normal cognition at age 85 too, so that's pretty good.
and there's all kinds of studies and research trying to figure out how to prevent this. But so far,
So far, the really good studies where you look at a large enough population with a control group that doesn't get treatment and a testing group that does get the treatment, we haven't landed on anything other than fitness, physical and brain fitness. We haven't landed on anything that can prevent dementia per se. So the studies looking at estrogen, vitamin E, studies looking at non-steroidal anti-inflammatory medications, and even studies looking at using the memory medicine we have now to prevent dementia. None of those have panned out to show that there's an overall benefit. And in some cases, such as vitamin E, it can actually be dangerous to take too much vitamin E, too much being more than 400 units a day, because of other risk factors, especially cardiac risk factors that they're discovering. So really important to look at the hard evidence that we have of what is useful. And, you know, we know that exercise and brain fitness is really good for your brain. So staying socially connected and staying active physically and mentally is really important.
and so far as treating the Alzheimer's once we've been diagnosed with it, there really isn't anything to cure that either.
That's true. We do not have a cure. The medicines we have nowadays are mainly to slow down the loss of memory, but it doesn't prevent it from progressing. It will still progress. There are many medications and other treatments in trials right now. In fact, the last I read, there's 93 different drugs, I'll say. They still have numbers, they don't have names yet. 93 different drugs in trials right now, and several of those are entering the phase 3 trials, which are the latest before they get into FDA approval. Many of these deal with stopping the formation of those protein clumps we talked about. And if we can prevent those from forming, that may prevent the disease from progressing. There's also some medications in trial looking at dissolving those that would actually potentially break down some of those plaques. So that could potentially mean an improvement. But the actual outcome of which one of these medicines will make it all the way through and be safe for us to use is an unknown right now.
It's probably out there with the cure for the common cold.
Right. Well, hopefully, yeah. Hopefully more research is being put into this because of the magnitude. You know, this is a huge problem, memory loss and the aging population coming on, because it is an expensive illness. It's one that affects not just the person with the disease, but it affects their whole family. Family members have to take off work or have to stop working in order to take care of a loved one, and that has huge economic impact. So the research is really stepping up to be able to find something sooner than later to help.
And when you're talking the progression of it being 10, 15 years, that is a very long time to
Right.
deal with a condition.
A condition, yeah.
Granted, in the beginning, the symptoms may not be that
Mm-hmm.
noticeable.
Mm-hmm.
But as it progresses, it gets harder and harder to care for that person because of the different behaviors.
Right. The one interesting thing is that the disease changes. So what seems to be working today for the person might not work in a year. Either the support network might not work or the medicine might not work. You might have to totally change what you're doing to live each day because the illness changes. Yeah.
And having to deal with that for that long period of time, it is very mentally straining on the family.
It is. It's huge. And, one important thing to keep in mind is that no one should really go this alone as far as a caregiver. It's definitely a team type of disease. It, again, doesn't just affect the patient, it affects the whole family. And the rate of caregiver burnout, caregiver depression is huge. And, not to go this alone. You need a team to take care of one person with dementia.
Well, if someone wanted to talk with you and your team, because I know you have a team there at the memory clinic, and it's not just you, it's different medical professionals. Talk about what's over there.
Right. Well, the North Idaho Memory Clinic is mainly 3 of us, and one is Barbara Beeville, who is a licensed clinical social worker, and she has special training in folks as they age and aging health as well as dementia. And she can certainly help plug people into resources and get information on a more one-to-one basis. The other member of our team is Dr. John Wolf, who's a PhD psychologist that does cognitive testing. And that's just kind of a big word for doing memory testing, paper pencil testing, evaluating what parts of the brain are working and what parts of the brain may not work as well as they were before. That information can really help us define what might be causing the memory problem, as well as help us define a support team geared toward that person's particular deficits. So an example might be that someone would respond better to a written cue as opposed to a picture cue. So it can help in day-to-day tasks, finding the bathroom or identifying the coffee pot. A written cue versus a picture can make a difference. And so some of that sort of testing helps to define that. And then my piece in the memory clinic is to evaluate for any medical problems or look at the medical history, review the medication list, review a brief neurologic type exam focused on, is there a stroke, is there Parkinson's, is there something else that's going on here, and any evaluating any scans or blood work that might be needed to tease apart a medical illness causing the cognitive problems as well.
And so you all can help as the person progresses through to the disease to help the family know kind of what to expect, to look at the different cognitive abilities to see where they are, and then to see medically if there's any sort of medications or anything medically going on in the person.
Right, right. And then oftentimes we will have the primary care provider continue to, I mean, they obviously continue to be involved in the person's care. And that sometimes they will continue to prescribe and monitor the memory medicines as well. Other times we may continue to do that particular piece, especially if there's special needs in adjusting medicines or different behaviors that come up that they want additional help for.
If someone wanted to get in contact with you, how would they do that?
So there's one number you can call right now that I'll give, which is kind of tricky because the offices have switched, but the phone number would be 208-664-3301. That's actually the number to the office I work out of, which is On Site for Seniors, which is a house call program, but that is where we do the memory clinic medical piece right now. So that would
So
be
if
the
they
easiest
wanted
number
to get hooked in to get evaluated to see
for
what the
memory clinic.
cognitive ability, what the medical condition, the resources for the family, they could go through that.
They could go through that office number, right.
Well, thank you so much for being here with us this afternoon.
Well, thanks for having me.
I know this is an issue that I will guarantee every single family is going to have to deal with at some point, if they haven't already, because we're all watching our families grow older, and we're all seeing our parents grow older, and if 50% of the people over age 85 are going to have a dementia, you guarantee that there's going to be a member in your family that is going to go through this. So it's really important to know this information and to understand what's happening, to understand that your loved one may not just be being ornery, that there might just be an issue going on that they don't understand, and to recognize that.
Right.
Well, thank you so much for being
Thank
here.
you.
And you've been listening to this Senior Moment, and I hope you all have a wonderful rest of your weekend. Good day.